Right, it's no shocker that football is the sport responsible for most of the concussions in youth sports, but what you might find surprising is what ranks second. It's girls soccer. A new study from the University of Washington found that girls between the ages of 11 and 14 suffer concussions at a much higher rate than those who play high school or college soccer. And more than half of those youth players who had symptoms of concussions, they never sought treatment. I'm going to make a note about that in just a minute. Joining me to talk about that and about the study is Dr. Rosen Crosby from Lapeer Pediatrics in Beverly Hills, who I'm sure has lots of patients between the ages of 11 and 14.
Many, yes.
Now, you and I talked in the beginning that the likely reason that that age group has a higher rate of concussions is because they have a lower skill set, right?
That's what I think a big part of it is. It's just the age, the experience. They haven't been playing for as long as a 17-year-old or an 18-year-old. And also, if you're that old playing, you've probably been playing for a very long time. You're probably pretty good.
Pretty good.
So you know what
right.
you're doing.
Exactly.
Whereas if an 11-year-old takes a header, you know, and they even said that during a game, taking a header was much more of a cause of a concussion than during practice because they're playing harder, yet they still don't exactly know what they're doing.
Or missing the header and hitting another person's head.
To head.
Yeah, exactly. Now, for all of you watching, especially if you're a parent or if you're a child who plays soccer, I want you to look at this list, okay? Because if you're on the field or you see somebody on the field, first of all, right off the bat, Dr. Crosby, if somebody's knocked out, that's a concussion.
They're out, yes.
They're out,
and
no question.
Right.
The next, headache.
Yes.
Blurred vision. Interesting, amnesia, because that isn't always present.
No,
right?
It isn't always present. And you can just have one of these symptoms. All you need is a head bonk, whatever it is, whether it's a fall, a jolt, or a blow to the head, and a headache. If you have an injury and a headache, you have a concussion.
Really?
Yes.
Just a head? You don't need the nausea?
You don't have to have the other symptoms. So any of those, and a head bonk.
And clumsiness is the other one.
Clumsiness, yeah, because if someone didn't see the head injury, there's a lot going on, and then you see a player who's just not living up to their usual skills, pull them out.
Pull them out and have them come. Now, would they come see their pediatrician?
They do actually come to see us first. And it depends how bad they are, because some will call. Some of them sound bad, and we will actually refer them to the ER because we feel they need a CT scan, which is a whole other issue of when to scan and when not to scan.
Well,
but we often make that decision.
And let's go ahead and put another list up, because when you're talking about treatment, there really is no actual treatment for most concussions, right?
Right.
But this list makes sense because that's what we hear about from the NFL.
Yeah.
Don't let them play again.
No, pull them out.
Pull them out.
And they're going to fight you on that.
Is that right? No physical activity. You have to have mental rest. And this is until the symptoms are gone. Is that true, or is it always for 1 week? Because
no,
I thought it was a 1 week standard.
I had a patient who had lacrosse injury from a stick injury and then a fall, and he was out 2 weeks. He came in 2 days after. He was dizzy. He just wasn't feeling right. He wasn't thinking. He was having a hard time concentrating, focusing. He was pulled from school and pulled from sports.
Can I just say, I know we have to go, but one last thing. I was always told when my kids were playing sports, don't let them go to sleep for more than like 3 or 4 hours the night of the concussion.
Wake them up every 2 to 4 hours.
Is it 2 to 4 hours?
Yep, wake them. They don't have to be awake and alert and talk to you, but nudge them, make sure they wake up, maybe ask them their name, something, who am I, how old are you, something they should know.
Wanted to make sure we got that in.
Yes.
All right, Dr. Rosen Crosby from Lapeer Pediatrics. Thanks very much for being here. Christine.